Spirometry is a simple non-invasive pulmonary function screening test that is often performed in the medical office. A computerized electronic instrument known as a spirometer is used to conduct the test. A spirometer measures how much air is pushed out of the lungs and how fast it is pushed out. Spirometry is often performed on patients exhibiting lung dysfunction, such as dyspnea, and on patients at high risk for lung disease, such as individuals who have been exposed to environmental pollutants for a long period of time. It is also performed on patients with lung disease such as asthma, chronic bronchitis, and emphysema. The medical assistant is responsible for performing spirometry testing in the medical office. The results obtained from spirometry testing provide numerous measurements that help the physician assess lung functioning. The medical assistant must be sure to conduct the test using proper technique to prevent errors in these measurements. The medical assistant will show you how to perform a spirometry test on a patient with asthma. Sanitize your hands. You must first calibrate the spirometer to ensure accurate test results. Calibrate the spirometer by injecting 3 liters of air into the spirometer from a calibration syringe. If the spirometer is properly calibrated, the output should read 3 liters, and the reading should not vary by more than 3%. If the machine is not properly calibrated, the medical assistant should consult the operating manual and adjust the machine as required. You are now ready to perform spirometry. Assemble and prepare the equipment. You will need a disposable mouthpiece and disposable nose clips. Apply a disposable mouthpiece to the mouthpiece holder attached by a cable to the spirometer. Greet and identify the patient and introduce yourself.
Hi, Miss Dunaway. My name is Vicki. I'll be working with you today.
Identify the patient and explain the procedure. Tell the patient that she will be wearing nose clips and performing a breathing maneuver several times to see how well her lungs are functioning. Ask the patient if she is prepared properly for the procedure. For 8 hours before the test, the patient must not eat a heavy meal or smoke. For 4 hours before the test, the patient must not take bronchodilators or engage in strenuous activity. Ask the patient to remove any heavy or constricting outer clothing, such as a jacket or sweater. Also ask her to loosen tight clothing, such as a tight collar or anything that may make it difficult for her to perform the breathing maneuvers. Measure the patient's weight and height precisely. These measurements are necessary for the accurate calculation of predicted values. The patient should be in a sitting position next to the machine to prevent dizziness or fainting during the procedure. Now you must enter the patient data into the computer database of the spirometer. Using the keypad, enter the patient's age, sex, weight, height, patient identification number, and whether or not the patient smokes. The computer needs this information to calculate the predicted values. The predicted values are what the result should be if the patient's lungs are healthy. Describe and demonstrate the breathing maneuver for the patient. Tell the patient to relax and take the deepest breath possible until her lungs are completely filled with air. Next, tell her to place the mouthpiece in her mouth and seal her lips tightly around it so that all the air leaving the mouth enters the mouthpiece. Then blow out as hard as possible and for as long as possible until her lungs are completely empty. Tell her not to block the opening of the mouthpiece with her tongue. Tell her to remove the mouthpiece from her mouth. Tell the patient you will repeat the instructions during the test. Encourage her to remain calm. Fear and anxiety can lead to unreliable results. Gently apply nose clips to the patient's nose to prevent air from escaping from the nostrils. The nose clips ensure that all breathing is done through the mouth. Hand the mouthpiece to the patient. When the patient is ready, begin the test by pressing the start button on the spirometer.
Hard, Keep going. Keep
Actively
going,
coach the patient
keep
to obtain
going,
accurate
keep
results.
going, and
Press the
good.
stop button
Okay,
on the
relax.
spirometer.
Okay.
Inform the patient of any
How you
modifications
doing? You
needed
two,
for the
breathe
next
in.
effort. Continue until you obtain 3
Okay,
acceptable
and
efforts,
go.
which are
Flow,
necessary to
hard,
ensure
hard.
valid test
Keep
results.
going, keep going. You're doing good. Keep going. Okay, and stop. Okay, relax. You ready? Okay, take a deep breath. Okay, blow out, out. Keep going, keep going, keep going. And stop. Good job. You did good. You did good.
Gently remove the nose clips. Remove the mouthpiece from its holder. Dispose of these items in a regular waste container. Allow the patient to remain seated for a few minutes, as she may feel lightheaded after the procedure. Sanitize your hands. Print the report and label it with the patient's name, the date, and your initials. As you can see, the report indicates the patient's measured values and the patient's predicted values. The physician compares the measured values with the predicted values to screen for the presence of pulmonary disease. Chart the procedure. Include the date and time, the name of the procedure, and the patient's reaction. Place the spirometry report in the patient's medical record and put the record in the appropriate place for review by the physician. Clean the spirometer according to the manufacturer's instructions.